Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Exocrine pancreas, and we're looking at some of the tests. So under the exocrine pancreas, there is some direct measurement of the pancreatic secretion. So we can write it as direct measurement. So directly you measure the pancreatic secretion. And this is in response to the standard stimulus. This is in response to a stimulus. So the stimulus to secretion, it can be physiological. So the stimulus, you can say it is physiological. And by physiological, what do you mean? By physiological, it can be example, the ingestion of a test meal. So as in the test meal, as in the balloon test meal, balloon test. Then in terms of pharmacological, it is IV injection. So IV injection is of a hormone such as the secretin or the cholecystokinin. Injection of a hormone, that is the secretin or the cholecystokinin. So it is CCK. Then there is duodenal intubation. Presence of the duodenal intubation. So the duodenal intubation has to be performed with a triple lumen tube test. So it is the triple lumen tube. So triple lumen tube, so that the gastric and the duodenal juices can be aspirated. So the gastric and the duodenal. So gastric and the duodenal juices. So the gastric and duodenal juices, they are to be aspirated. And the non-absorbable marker. So there is also non-absorbable. There is non-absorbable marker. So such as the polyethylene glycol. There is a polyethylene glycol. So it is used to access the completeness of the aspiration. So this will show the completeness of the aspiration. Next we come across is the nitro-blue tetrazolium. So there is presence of the nitro-blue tetrazolium. So there is something known as the nitro-blue tetrazolium. This is the para-aminobenzoic acid. So it is a nitro-blue tetrazolium para-aminobenzoic acid. So in short, it is known as the NBT PABA. So NBT PABA test, and this provides an indirect measure to the pancreatic function. So pancreatic function is assessed. So the substance is administered orally and degraded in the gut. So it is administered orally and then it is degraded in the gut. So this is by the pancreatic enzymes. Next is, and the breakdown product. So the breakdown product is nothing but PABA. So PABA is nothing but the breakdown product. This is absorbed by the intestine. And it is excreted in the urine. It is excreted in the urine, and also the urine level. The urine level is measured. So then we move on to the pancreolaureal test. So it is known as the pancreolaureal test. So this test, it works on the simple principle, that is the tests are very cheap. So the test is very cheap, as well as it is easy to perform, but they are non-specific. Especially it follows the gastrectomy So it follows a gastrectomy, and in conditions they may alter the gastrointestinal transit. So it also alters the GI transit, gastrointestinal transit, and the intestinal absorption capacity. And the intestinal absorption capacity. Next is we look at the measurement of the fecal elastase. So there is measurement of the fecal elastase. So the measurement of the fecal elastase is 1 in the stool. 1 in the stool. So this test, this is basically, it is simple and specific. It is simple as well as specific, and it is widely used. So you can tell it is commonly used. So what is the interpretation? Interpretation is above, that is greater than 200 microgram per gram feces. This is normal, and between the 100 to 200 it is mild to moderate, and in terms it is less than 100, this is going to be established for the diagnosis of the severe pancreatic. So this is known as the severe pancreatic exocrine insufficiency. Exocrine insufficiency. Next is the fecal fat and the weight estimation test. So we look at the fecal fat as well as the weight estimation test. So in terms of this, first we measure the stool content. So we have to measure the stool content. So we measure the stool content of fat, and this is after the nutritional intake of 100 gram per. So this is after the nutritional intake of 100 gram of fat. So you have a nutritional intake of 100 gram of fat. This is per day, and this is during 3 days. Next is if the stool fat content exceeds 7 gram per day. So it exceeds 7 gram per day. This is when the diagnosis of steatorrhea is established. So then you call it as steatorrhea. To learn and grow daily like this, please do subscribe.